So you may have been diagnosed with IBS and could be wondering what exactly is going on and what can you do to get this taken care of you. Well, in this video today, I'll explain why it may be easier to treat IBS than what you think, what exactly is IBS, what causes irritable bowel syndrome, and at the very end of the video, I'll give you my recommendations I give for all IBS patients as a gut expert. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I'll put a link right here where you can get great tips and tricks just like this one. So you may have been diagnosed with IBS and could be wondering exactly what is going on, why do you have IBS, and what can we do to treat this? So the best way I recommend for us to talk about this is let me give you a case study of a patient that I actually took care of who had IBS. LJ is a 32-year-old female who came to see me for a second opinion after she developed gut issues 2 years ago after a trip to Mexico. Both her and her husband suffered from an acute onset of diarrhea, pain, nausea, and a whole bunch of gut issues after eating some bad food on her vacation. Several other guests went with her and they also got sick. Man, what a terrible vacation that was. They all thought they got some food poisoning and all the rest of the guests got better after a couple of days, but LJ didn't. Since that time, she's been suffering from lower abdominal pain, bloating, diarrhea, and crampiness that has not gotten better with conservative treatment like changing her diet. She frequently feels bloated and states that she looks 4 months pregnant. Does this sound familiar to you guys? Because I hear this all the time. She saw her internist quickly after coming back. We did a whole round of stool testing and blood testing and everything came back negative. She was told that this was a result of her infection and it should go away over time. But guess what? It didn't. After a couple months of this, she went back to her internist. We did further testing, including checking for a condition called celiac disease, and this came back negative as well. A CAT scan, which is an imaging test of your whole GI tract, was performed, which also came back normal. Yes, you guys guessed it, normal. She tried avoiding dairy, tried avoiding fructose, tried a gluten-free diet. None of that made anything better. She was told that it's all in her head, and she should just eat around it and try to figure out what foods may be the triggers. She tried this, couldn't figure out any food triggers. She didn't get any results. She went to go see another GI doctor. That doctor did a whole bunch of testing, including repeat imaging, repeat stool testing, repeat blood testing, and endoscopies. And every single test came back, you guys got it, normal. She was very frustrated by this diagnosis, didn't know what was going on, and was wondering, is this going to consume her life? Then she came to see me. And I knew from the very beginning, based on her symptoms, that she had irritable bowel syndrome. So we actually have a medical definition for IBS. It's based on Rome 4. So Rome, yes, actual Rome. This is an actual place where a whole bunch of GI doctors get together and talk about diarrhea and constipation. And in this consensus group, they decided what the criteria is going to be for irritable bowel syndrome. Here it is. You have to have recurrent abdominal pain for at least 1 day per week for at least 3 months. In addition, you have to have either the pain related to defecation, association with a change in the frequency of your stools, or a change in the appearance of your stools. Now, abdominal pain is a primary component when it comes to irritable bowel syndrome. So if I have somebody come to see me with just straight up diarrhea without pain, they do not have irritable bowel syndrome. Pain has to be a component in that, including either a change in the appearance of the stool, the frequency of the stool, or the pain related to defecation. Hey, if you're getting value from this video, I would appreciate if you smash that like button and comment it down below. Now, there are a lot of other symptoms associated with IBS: bloating, nausea, indigestion, feeling like you're pregnant all the time. And these are associated symptoms with IBS, but IBS is the global symptomatology that you may be having. Now, there's 4 main types of IBS. IBS-D for diarrhea, IBS-C for, you got it, constipation, IBS-M for a mixed pattern in between diarrhea and constipation, or IBS-U unclassified. Now, a lot of patients can fluctuate between one stage or the other depending on what's going on. But other people may stay all the way on the diarrhea side or all the way on the constipation side. Now, I use what's called a Bristol stool scale to help me determine exactly what type of IBS that you have, because I will tell you, a lot of people tell me they have diarrhea when in essence they have a normal formed stool. So that's not diarrhea. That Bristol stool scale goes from a scale of 1 to 6, with 6 being very watery stools and 1 being very hard stools. Bristol stool number 4 is what I call the golden poo, the magical poo, the poo that we always gain for. Very little splash, goes down easily. Gold medal, best poo you can always have. This is the poo that we aim for, but I use this scale to allow me to determine exactly what is going on with your symptoms. Now, there's that one diagnostic test that tells me that you have IBS. There's that one thing I can order, one thing that I can see, because it may involve a couple of different testing, different questions, and different options for us to finally get to a diagnosis of IBS. Now you may be wondering what causes IBS. There are a lot of different causes. It's not one single cause that will cause you to have irritable bowel syndrome. For some people it's stress. For some people it's a change in the gut microbiome. For some people it's connection between the brain and the gut-brain axis. For others, there's actually localized inflammation inside the lining of your colon called leaky gut. Yes, this is a real condition in which we see actually changes in what are called the tight junctions of your small intestine and colon. For some people, it's trauma that you've had in the past that can manifest as gut issues. For others, it's a changing in the motility. Maybe it's too fast. Maybe it's too slow. Maybe it's not coordinated correctly. Maybe it's diet. My point is, there's not one particular way for us to tell you this is the reason why you have IBS. It could be any number of those different things, a combination of different things. Maybe it's stress in the gut microbiome. Maybe it's dietary changes and trauma you've had in your past. The reason I mention this is that there's not one single prescription I can recommend to all my IBS patients. For some people, food may be a trigger. We'll change that. For others, it may be stress. We gotta work on that. For others, it's a change in the gut microbiome. Gotta fix that. For others, it may be a change in the contraction of the gut. We need to work on that. And so this can be very frustrating for a lot of our IBS patients because they're coming to see me and they're wondering, why can't I give them a simple treatment? And the answer is, we don't have one simple treatment when it comes to irritable bowel syndrome. Having said that, there are a couple things that I recommend for all my IBS patients to try and do to help out with their symptoms. Number 1, eliminate all processed foods. If you're wondering what is a processed food, it is food that is in some sort of wrap. So don't eat that, guys. If it's wrapped up in some sort of saran wrap or it's in some sort of plastic wrapping, that is a processed food. There's so many bad ingredients in them, things that will not help out with your gut and can make IBS symptoms worse. Eliminate those. Number 2, if you have diarrhea, just completely eliminate dairy. Just get rid of it. You don't need the dairy to give you the calcium. And for a lot of people, they don't realize that they're lactose intolerant. Just get rid of it. Number 3, remove all artificial sweeteners. Now you may not realize this, but you may be actually ingesting artificial sweeteners from diet drinks, candy, sugarless gums. Maybe you're using an artificial sweetener to sweeten up that coffee. Get rid of that. A lot of side effects include bloating and diarrhea from that. Number 4, if you're having a lot of pain, try something to help soothe the gut, whether it's fennel tea, peppermint tea, or ginger tea. These are things that have been used in clinical trials to help relax the gut, make it easier, and preventing the cramping from occurring. Number 5, consider a probiotic. Now, probiotics have been touted as being the end-all be-all for everything. Guys, that's not true. There are some people in which probiotics do work. There are others in which it makes no difference at all. Try it for a couple weeks, see if it works, see if you are one of those in which you'll have a benefit for. If you don't, not a big deal. Not everyone will benefit from a probiotic. Number 6, I would recommend highly to add a prebiotic fiber. Prebiotics are foods that help to enhance the natural bacteria inside our GI tract. Our GI tract have these microbes that are starving for some of the good things to proliferate and multiply to get rid of some of the bad bacteria. One of the best ways that you can do that is to add a prebiotic fiber. Things like wheat dextrin, guar gum, psyllium. These are very effective, natural prebiotic fibers that will totally enhance your gut microbiome. I would recommend that over anything else. Now, my tip for you guys is to start low and go very slow over some time. The biggest side effect that people get when it comes to taking too much fiber at once is a lot of bloating and distension. So go low and go slow. Number 7, find some way to help relax yourself, whether it's de-stressing with yoga, exercise, acupuncture, deep breathing, gut-directed hypnotherapy. These are things that have been used in actual clinical trials to help out with IBS symptoms, especially when it comes to pain. What it does, it helps to direct your emotions away from what's going on inside your gut to something outside. And it provides you a way to balance what's going on, to give you coping mechanisms, and to get you feeling better. There's very good clinical evidence. This helps out with IBS symptoms. And then also consider getting psychological help. I did mention the effects of trauma on the gut. I did mention the gut-brain axis. There is a connection between what's going on here and what goes on right here as well. So a lot of people manifest their stress here inside their GI tract, or they've had trauma in their past they don't realize is really causing them to have a lot of gut issues. If you need that, if you have that, don't be afraid to seek out psychological help. I commonly recommend this to my patients who I know have anxiety or depression, because getting that help will help out with your gut and will also make you feel better as well. And then lastly, consider medical therapy. Not everyone's going to benefit from a natural approach when it comes to IBS. Now, I am the type of physician that if we can do a natural approach for you, I am for that all the way, but not everyone is going to benefit from that. It doesn't work for everybody, or some people just so want to change their diet. That's fine, guys. I'm here for you. If you need medical therapy, we have the medical options for you. It is not a sign of weakness. It does not mean something is wrong. It doesn't mean that you're doing something bad. Some people just need a boost medically to help out what's going on with their gut issues. So let's go back to the case. I was seeing LJ for the first time, and what I did is actually sat down and I listened to her story. I wanted to make sure that I can establish a strong physician-patient relationship. I was in her corner. I wanted to make sure that she understood this, I heard what was going on, and I was going to try to help her as best as I can. I also straight up asked her, does she have any fears of what's going on? Because she told me she was worried that something would be growing inside of her. Aha, that was a clinical clue for me, because I knew that if that was a worry for her, I need to address that in this visit. I did a physical exam, I reviewed the testing that she had before, and I told her definitively she had irritable bowel syndrome, IBS. This was the cause for what is going on with her gut issues. Based on all the testing done from her before, all the blood testing done from before, and most importantly, her history that she explained to me, she had IBS, most likely secondary to that infection that she had in Mexico. This is a very common reason why people are getting IBS. It's called post-infectious IBS. We're seeing up to 20 to 30% of patients who had some sort of gastroenteritis or food poisoning develop really, really bad gut issues after that fact. And I told her symptoms fit classically for the Rome 4 definition of what IBS is, and I told her she did not have any cancer or anything else bad going on besides IBS. It's a very annoying disease to have, but will not kill you, nor will it shorten your life. And then we focused the treatment on her symptoms. So if she was having a lot of bloating and wanted to try dietary therapy, we offered dietary approach. Because she had an infection that most likely was the trigger for her gut issues, most likely she had to change her gut microbiome, and we gave her a course of a medication to help change the gut microbiome for at least 2 weeks to improve her symptoms as well. So pain was an issue as well, so I started her on a medication to help change the hypersensitivity of the GI tract. I also sent her to a colleague who focuses on cognitive behavioral therapy in IBS patients to help her to improve her own gut issues. 1 month after this initial trial treatment, she felt so much better, her gut issues were gone, and she had relief of her symptoms. So guys, I want to thank you for watching this video. So my question of the day for you guys, what questions or concerns you have about IBS? Comment down below. I'd love to hear what you guys have to say. But thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter. I'll put a link right here where you can get the best tips and tricks just like this one. Guys, I want to thank you for watching. Hope you guys have a happy day. Thanks, y'all. Let's talk about poop. Woo! And if you want to learn more about IBS, don't forget to click this playlist right over here.